There are certain do's and don'ts that you have to follow strictly throughout your treatment. Keep your braces and teeth sparkling clean by brushing, flossing, and regular use of mouthwashes. One of the most common fear about orthodontic treatment is that braces may cause tooth decay and gum diseases, as food can get caught in braces. So to prevent permanent damage to your teeth during the treatment, oral hygiene is imperative. Develop a pattern of brushing that covers all the surfaces of your teeth. Try to use a toothpaste that contains fluoride. Brush the entire surface of each tooth in an oval or circular movement with the toothbrush. Tilt it and brush slowly around the braces. That is where the plaque and calculus accumulates. Concentrate on the areas between the braces and the gums. Brush the chewing, biting, and inside surfaces of the teeth. And do not forget to brush your tongue. Brush after every meal and snack and at bedtime. There are special orthodontic interdental toothbrushes available that are used to clean under the orthodontic wires and around the braces. Flossing daily is your best weapon against plaque hiding between teeth and gums. Make sure you know how to get in and out of tricky areas. A floss threader may be helpful, leaving an inch or two to work with. Carefully pull the waxed floss between the wire and braces and gently follow the curves of your teeth. Floss around each tooth, especially around gum areas, but avoid snapping floss on the gums. Floss removes plaque that was missed after brushing. Fluoride mouthwash will protect your teeth from dental caries, while antiseptic mouthwash is helpful to control mouth burns, cheek bites, or any toothbrush abrasions. You may have to make some changes in your eating habits, as some foods lead to tooth decay or loosen braces. For the first day or so when you get your braces, you will have to stick to soft diet. Things that you will have to avoid all the time during your treatment are nuts, peanut brittle, ice, jelly bears, bubble gum, candied apple, chewing on pens, pencils or toys, pushing your tongue against your teeth, biting your lip, biting your fingernails. But there are other things that you can eat, but carefully, like apples, hard French bread, hard chips, sodas, corn on the cob, and carrots. At the completion of the active part of orthodontic treatment, the braces are removed and retainers are fitted to hold the teeth steady in their new position. These appliances may be removable plates or wires fitted behind the teeth. Retainers play an important role in orthodontic treatment because if they are not worn according to instructions, the teeth may move back towards their original position. It is usually worn full time for up to 1 year, except for when you eat, when you brush, when you swim, or when you play sports. Wear it at night for a further year. The corrected teeth are observed periodically for up to 5 years after the retainers have been phased out. During retention and subsequent observation period, you are expected to visit your orthodontist once or twice a year. But make sure that you wear them as directed and keep them cleaned thoroughly. Handle your retainer with care as it is easier to lose but expensive to replace. Most children with crowded teeth and bad bites have narrow and underdeveloped lower jaws, which could be corrected with functional appliances. Functional appliances help correct the bone problem, while the teeth problem are carried out with orthodontic braces. The ideal age to use it is between 7 to 11 years, when the cooperation level is highest. However, it can also be used at an age of 4 years if the upper jaw is too narrow, causing breathing and speech problems. In case of adults, it is used to develop the arch to a more normal shape and size before applying braces. The use of functional appliances can reduce the time of wearing fixed braces and the need for extraction of permanent teeth. Functional appliances develop the dental arches so that all the permanent teeth can erupt, which will ensure an outstanding profile, broad smiles, and healthy jaw joints. There are very few true orthodontic emergencies. Most problems can be remedied at home. However, if you have a situation that you cannot resolve on your own, call your dentist ASAP. As your braces put pressure on your teeth, you may experience some pain. You can take painkillers for it. There might be some degree of soreness and irritation to the cheek and tongue. Try using a warm washcloth, heating pad, warm saline rinses, or cover the sharp area with wax. This will reduce the soreness in your jaws. If the main wire or a bracket becomes loose, call your dentist to see if the bracket needs to be refitted. If you have a situation where you must cut the wire or slide a bracket off the wire, you may use a fingernail clipper that has been washed and sterilized. Contact your dentist to schedule a repair appointment. If your braces cause irritation, try moving the wire away from the irritated area with a cotton swab or eraser. If the wire will not move, try covering the end of it with a small piece of cotton or a small amount of wax. If the wire is painful, you can cut it with a nail clipper or scissor that has been washed and sterilized. If a separator comes out, call your dentist to see if it needs to be replaced. Some patients may lose a separator during treatment, which is common. Successful orthodontic treatment is a two-way street that requires a constant cooperative effort by both the orthodontist and the patient. To successfully complete the treatment plan, patient must correctly use the orthodontic appliances to deliver forces in a very specific manner. If the appliance is not worn as requested, the treatment will not proceed as planned. Maintain proper oral hygiene by brushing, flossing, and fluoride mouth rinses. Take care of the appliances. Lost, broken, or bent appliances can lengthen the treatment time, as unwanted tooth movement may occur if the appliance is not working. Avoid foods that might damage the braces or the teeth. Keep your appointments as scheduled. Appliances must be adjusted periodically and treatment progress is monitored carefully. Missed or rescheduled appointments can prolong the treatment time. Brace yourself to look good and feel your best. Then you too will have many good reasons to smile.